Well, thank you. My name is Nick Von Bergen. I'm a pediatric cardiac electrophysiologist and also co-founder of Agility Medical and co-inventor of the AtriAmp. And in my work as a pediatric cardiac electrophysiologist, a common experience for me is after a major open heart surgery of one of my patients. So, for example, a 3-year-old who comes to the ICU and has a gradually increasing heart rate. And the bedside monitors will show an EKG just like this. This is a real EKG from one of my patients. And what we can see is very big ventricular signals, so the chambers on the bottom chambers of the heart, signals from the bottom chamber of the heart, but I cannot see where the atrial signals happen to be. And the challenge with not knowing what the atrial signals are is it's impossible to make an accurate rhythm diagnosis. So the challenge in my clinical work is that bedside monitors are inadequate for accurate rhythm identification. But we know what to do. There's been recommendations for years about taking advantage of the atrial epicardial pacemaker leads to give you a more accurate diagnosis. So wires can be placed on the outside of the heart at the time of surgery on the atria, and these can be hooked up to an EKG to give you the highest quality signal. This signal is actually especially useful for the diagnosis of arrhythmias in children, but there are currently barriers to use. First, patients may or may not have these atrial epicardial wires placed at the time of surgery. And even if they do, it can take time for me to page the EKG technician. They'll come to the ICU. It may take 10 minutes or more. They adapt a 12-lead EKG. They give me a 10-second snapshot. They rip off one of those EKGs, give it to me, and then they leave. I may make a change and want them back. So unfortunately, the current standard of practice, which is using an atrial EKG with the typical EKG, is inadequate for accurate and timely monitoring of our patients. But we should still use the atrial electrogram. There's data that suggests that the atrial EKG can be invaluable in establishing the diagnosis. This can then allow treatment to be started. There was a very nice study a few years ago looking at how accurate diagnosis using the atrial EKGs can both improve healthcare costs and improve patient outcomes. And an article I thought was fairly worrisome, actually. It was done a number of years ago, but it looked at the use of atrial EKGs and more accurate rhythm identification. What they found was even without use of the atrial EKGs, when patients did not accurately identify the rhythm, they will still sometimes do an intervention, meaning we have inadequate data and then we're operating with interventions based on inappropriate interpretations. What we found with the AtriAmp, we've had a pilot study at the University of Wisconsin-Madison that we have shown improvements in accuracy at a p-value of 0.07 with our small pilot study and improvements in confidence in the diagnosis in comparison to the bedside monitors. So here's the AtriAmp itself. The AtriAmp is, you can see this little figure over here. So the AtriAmp connects to atrial epicardial wires, so wires placed on the outside of the heart at the time of surgery, connects to the AtriAmp, and then the AtriAmp connects to the precordial lead. It's also labeled as the V lead to allow us to have continuous monitoring of the atrial electrogram. And let's look over here at the bedside monitor. So this is actually a video of a bedside monitor. This is a surface electrogram here. You can see the nice ventricular signals. And down here is the AtriAmp signal with an atrial electrogram. This is on the V1 lead. And you can see the ventricular signals and the much larger atrial signals. So this is the beauty of the AtriAmp. It is much easier to see the atrial signals, which can give you the definitive diagnosis. The atrial EKG, as I mentioned, should be displayed concurrently with a surface electrogram. If you do need to pace, you can also hook up to a temporary pacemaker, as you can see right here, into the AtriAmp to allow pacing through the atrial epicardial wires. And the device does come in a double sterile package that can allow it to be used in the OR if necessary. So this is the example from the patient that I showed you first. This was the EKG example up here. And down below is the AtriAmp signals. So you'll notice up here, you just do not see the atrial signals. And down here, from across the room, much larger atrial signals than seen on the surface electrogram with the AtriAmp. So this is the beauty of the AtriAmp, the ability to see from across the room what the rhythm happens to be. Here's a demo because I'd like to show you what the AtriAmp looks like. This is the AtriAmp here. We have both a negative and a positive port for placement of the atrial epicardial wires. To insert those wires, you push the spring-loaded plug right here. That allows you to insert the atrial epicardial wire. This is the one that goes to the epicardium, the negative port that you will pace through. You can stick another epicardial lead or a skin lead into the positive port. We are now ready to hook the device up once we move the gray and the blue parts apart to hide the wires so they're less likely to have electrostatic discharge or be frayed. And now we can connect to the monitor. By removing the cap here to the electrode here, we can now hook the lead. This is to the precordial lead from the patient bedside monitor, and we're now continuously monitoring the atrial electrogram. At the same time, if we need to pace, we can disconnect the cap from the pacing connection, and then we used an either Oscore or Medtronic connector cable with the connection to the AtriAmp as you see here. So we now are hooked to the patient, the bedside monitor, and to a temporary pacemaker if needed. As it mentions down here, the device is FDA approved. It is a disposable single-use device for postoperative cardiac patients that have the atrial epicardial wire. So as we summarize, what is the advantage of the AtriAmp? We first have to look at what is the advantage of the atrial EKG, and in particular, it's the highest quality signal as recommended by the American Heart Association. At the same time, we have the advantages of the bedside monitors. In particular, we have continuous real-time monitoring. It's accessible on remote telemetry, and you can even do things like historical review. The AtriAmp combines the benefit of the atrial EKG, highest quality signal, and the bedside monitor. And in addition to that, it can provide a pacing connection for either bradycardia or overdrive pacing if needed. Subjectively, at the University of Wisconsin, we've seen that we are ordering less EKGs, less atrial EKGs, and this can actually allow us to reallocate resources or the EKG tech to other places instead of having to come frequent to the ICU. We've noticed earlier rhythm identification, and based on other studies, we expect this will translate into decreased morbidity, mortality, and potentially hospital costs. In the future, we are evaluating whether or not the device itself will be reimbursed by insurance. I'm very comfortable with this statement down here based on my experience at the University of Wisconsin-Madison. The AtriAmp improves the care of our most critically ill patients. And in pediatrics, I think it should be the standard of care. So now I'd like to take you through some additional examples, real-life examples of the AtriAmp to kind of help with understanding the benefit of the AtriAmp and also a little bit of how to interpret the atrial EKG signals. Here's a movie here of the AtriAmp itself. I'll pause it briefly so that we can see. Here's the surface electrogram right here, and then down here is the AtriAmp signal. So you can see the ventricular signal here, and then right before it, the much larger atrial signal. This is an example of sinus rhythm, and I brought another example in of sinus rhythm on the bedside monitor with the AtriAmp signal here. So once again, if you say look at the lead up top here, nice ventricular signals. Impossible to identify the atrial signal. You can actually see it small atrial signal there, but much larger, easy to see atrial signals on the AtriAmp lead. As we move to some abnormal heart rhythm examples, we have the surface lead here, and we're going to bring in the AtriAmp lead right here. So this was an example of a wide complex rhythm that you can see here that my fellows the next day said, hey, I think we have an atrial arrhythmia with aberrancy. So a rhythm from the top chamber of the heart that's a bit less concerning, and that kind of masquerades as a more concerning ventricular signal. So we said, well, let's look at the AtriAmp signals to get the definitive diagnosis. And what we can do here is we can look at the atrial signals here, a ventricular signal, atrial signal, ventricular signal. And now you can actually see a small atrial signal with the wide complex ventricular signal. And now the ventricular signals you can see are faster than the large atrial signal that is actually invisible on the surface monitor. So we have a ventricular signal, ventricular atrial signal. So this actually is a definitive diagnosis of a short run of a ventricular tachycardia, not, as the fellow suspected overnight, an atrial arrhythmia with aberrancy. And it's diagnosed by the easy and accurate identification of these much larger atrial signals that were unidentifiable on the surface electrogram. So as we move to another example here, this is another example of a wide complex rhythm. Once again, this is a typical bedside monitor. and we can see these nice wide complex rhythm. Now we're going to bring in the AtriAmp signal right here. And so even though we couldn't see the atrial signal here, we can easily see a larger deflection. It's not especially large, but it's much larger than down here. A large deflection that's easy to see that shows us that it's an atrial driven rhythm, atrial signal, then ventricular signal. And so this is not an abnormal heart rhythm. This is a normal rhythm with this wide complex QRS. So a nice confirmation of a sinus rhythm and a wide complex rhythm. Here's an example of short pauses that we could not identify the cause of on the bedside monitor. In this case, we have a atrial signal, a ventricular signal, atrial signal, ventricular signal, atrial signal, ventricular signal. Then we have this pause. This is a repolarization and a pause. And once we had the AtriAmp signal, so you can see the AtriAmp signal right here, atrial signal, ventricular signal, walk on through, and you can see here is a large atrial signal that is just, it's hidden in that T wave, in that repolarization here. So this large atrial signal proves that it was an early atrial beat that didn't conduct down to the bottom chambers, as opposed to a pause in the atrial rhythm itself. So very easy diagnosis when using the atrial electrogram, when using the AtriAmp. I brought this slide in here because I want to show you how definitive, how accurate you can be with the diagnosis when using the AtriAmp, even on the bedside monitors. So this is a post-operative patient who was just actually a few weeks old and had a sudden increase in the heart rate up to about 260 beats per minute. And this is the surface EKG. When we bring in the AtriAmp EKG, you can see it right here, we can see very definitively this nice ventricular signal there, and then just a little bit afterwards is the atrial signal. So we can even measure the timing from the ventricular to the atrial signals, and if we wanted to, we could use an algorithm-based approach to try to diagnose that, hey, this is most likely the arrhythmia called atrioventricular reentry tachycardia. This is another example of a post-operative patient that came up to the ICU. And as I looked at this rhythm, I said, well, it looks like this could be more ventricular signals than atrial signals. And if we just look at some of the ventricular signals, we can see ventricular signals nicely here. Then you see an atrial signal, and then maybe there's one here, another atrial signal here, perhaps here. So it looks like there may be more ventricular than atrial signals, which would suggest an arrhythmia like junctional ectopic tachycardia, or JET. But as we bring in the AtriAmp signal, so they have the AtriAmp atrial EKG, we can now easily see there's an atrial signal, atrial signal, atrial signal, atrial signal. We actually have more atrial than ventricular signals. This changes the diagnosis quite a bit. This is actually an example of heart block, as opposed to an example of junctional ectopic tachycardia, which is much easier to see on the AtriAmp EKG. Here's an actual example of junctional ectopic tachycardia, just for comparison to the last one. We can see here that we have the surface electrogram up here. We do not see any atrial signals anywhere. And now what we can see is that there's a sharp deflection that's larger on the AtriAmp signal than the surface electrograms. This is the atrial signal. It's following the QRS, proving that this is a junctional rhythm, as opposed to, like some of the previous EKGs, there's little P waves hidden in the T wave. That's not the case here. It diagnoses a junctional rhythm very easily by showing us exactly where that atrial signal happens to be. And then this last example is an example of what you can do with the AtriAmp because of the pacing capabilities. So this is a patient in the background. This is lead 2 here. So a rapid rate. This is actually the patient we showed before with supraventricular tachycardia. This is a rapid rate here. We hooked the AtriAmp up to the V1 lead and we paced. And now you'll notice it looks like there's a lot of artifact, and there is a lot of artifact. When you're pacing through the AtriAmp, it will oversaturate the monitor on the V1 lead itself. We paced rapidly. They converted out of their abnormal heart rhythm, went back to a sinus rhythm. We had a few extra pacing beats. And once we stopped pacing, the EKG came back. We could actually see what the atrial signal and ventricular signal just off to the right side of the screen here. But this is a good example of the advantage of the AtriAmp and the ability to pace rapidly, even while hooked up to the atrial epicardial wires. The AtriAmp does come in a 5-pack. As I mentioned, it's sterile, double packaged to use either in the ICU or the OR. And also the AtriAmp cables similarly come in a 5-pack, also single use and sterile, double packaged. Thank you.